for us to do studies, for us even to gather here and share our research findings as far as antimicrobial resistance is concerned through this important symposium at Muhimbili University of Health and Allied Sciences, of which it became the reality. Otherwise, had it been, there wouldn't be conducive environment, nobody would be here. And therefore, we really extend our sincere appreciation. If we don't mind, we can clap hands. Ladies and gentlemen, today, MUHAS stands not only as the host of the EMARA Symposium, as we are here, but also as a committed partner and a leading university in the fight against antimicrobial resistance. I've been seeing so many things going on within the university, of which they are really the champion as far as the fight against antimicrobial resistance, of which a threat that transcends borders, sectors, and generations. Antimicrobial resistance is among the 4 most causes of mortality worldwide and contributing to an estimated 4.71 million deaths annually. 4.71 million deaths annually, with 1.14 million directly attributed to bacterial antimicrobial resistance. This is mentioned only in the human sector or in the public health sector, leave alone in the livestock sector. For sure, it is a problem. And the science is unequivocal. Antimicrobial resistance is the current and the future threat, and its consequences are being felt globally, regionally, and nationally in every community within every healthy system. Imagine in one location resistant antimicrobial resistance, and its commitment has been very clear, of which the National Action Plan on EMARA of 2023 up to 2028 involves through the multidisciplinary One Health approach by broadly advancing antimicrobial resistance interventions. Tanzania has made a remarkable contribution to the commitments of 2024 United Nations General Assembly high-level meeting on EMARA, achieving up to 14% reduction in EMARA-associated deaths and an 88% decrease in the national antimicrobial consumption. That is a very big milestone. And if we don't mind, we can also clap hands to ourselves. But furthermore, enhanced sharing of antimicrobial resistance data on regional and global platforms, and increased domestic financing for implementing of the National Action Plan on antimicrobial resistance. Ladies and gentlemen, furthermore, to strengthen antimicrobial resistance awareness, as we are doing now, we are further advancing the awareness to the public. Thanks to the media, they are here with us, and just a single sentence spoken in this room, the whole world is going to get informed within a short time as possible. And therefore, for this case, to strengthen the antimicrobial resistance awareness and risk communication, Tanzania has translated the term antimicrobial resistance, EMARA, into a Swahili word, because sometimes the local people or the ordinary people in rural areas, in streets, they might not know what does it mean by that closely related medical term, antimicrobial resistance. What does this mean? but we managed to translate it to usugu wa vimelea vya magonjwa dhidi ya dawa. In short, we call it UVIDA. Usugu wa vimelea vya magonjwa dhidi ya dawa. In short, we call it UVIDA. And therefore, making it more accessible to a wider community. And the numerous nationwide MARA awareness campaigns have been conducted, reaching the audience from the national to the local community levels, using those simplified words. And a notable example is the Tanzanians' unique campaign, which went viral by the end of last year, including this year, known as Holela Holela Itakukost. Holela Holela Itakukost. For those who have never heard about Holela Holela Itakukost, you can just Google in your phone and then try to listen what is coming out. And you can agree with me. But the Holela Holela Itakukost is a creativity blends which brings science and art together to deliver simple and up educational message to the public, of which we did the assessment from the time the Holela Holela Itakukost was out up to the end of last year. Up to 24.7 million community members were reached by that campaign. So this is a big achievement, of which the campaign has been recognized as a best practice in the African region, and was documented by the Africa CDC, a MARA landmark report, and this was published in 2024 as among the very unique campaign. And I happened to attend a meeting in Cameroon last 2 years. The Holela Holela was the song of the day. And those who were not aware of the Swahili meaning, I was doing a lot of translation to them, and they were so much excited. That song was being sung by every participant who attended that conference. So it's really a breakthrough. But Tanzania has also established a parliamentary alliance to advance integrative and coordinated efforts in combating antimicrobial resistance through legislative action, policy, advocacy, health promotion initiatives such as WASH, and resource mobilization. This alliance strengthens collaboration between policymakers and stakeholders who are engaged in antimicrobial resistance. So we thank really the initiative that the members of parliament who are making policies and legislations for this country, if they know what do we mean by antimicrobial resistance, it's easier even to allocate more budget in the fight against this enemy. Ladies and gentlemen, acknowledging the critical roles of infection prevention and control, IPC, alongside water, sanitation, and hygiene, WASH, Tanzania has worked diligently to reduce infections. And this progress has been achieved through mechanisms designed to prevent, monitor, report healthcare associated infections in both clinical settings and communities, resulting in a remarkable 60% improvement in IPC compliance. Again, we can clap hands for that achievement. But not only in the public health sector, because our theme is on One Health, advancing issues of antimicrobial resistance using the One Health approach. In the animal sector, as we are talking now, biosecurity measures have been so much strengthened across most of the commercial chicken farms, most of the commercial pig farms, cage fish farms, and to some extent to the dairy cattle farms, ensuring that the product which is produced is of very high standards, is safe, and suitable for human consumption. Because if you read through the details of literature, the antimicrobial residues which emanate from the milk we drink, from the meat we eat, from the fish we eat, has a very strong positive contribution towards antimicrobial resistance, which we are now talking in this symposium. So that's what we are further giving an assurance and a milestone that through biosecurity, tremendous changes has been realized in our production system in livestock. But furthermore, vector and vector-borne diseases through control in livestock by use of some pesticides, acaricides, and others are being extensively undertaken. And this has a direct translation that if the vector and the vector-borne diseases are controlled in livestock, the uses, the unnecessary uses of antimicrobials in treatment of these diseases which are transmitted by vectors will tremendously go down, and has even gone down more. And this is an achievement. But of greatest interest, nationwide, we in the Ministry of Livestock and Fisheries conducting some vaccination campaign against the priority livestock diseases, of which was inaugurated by the Honorable President of this United Republic of Tanzania last year. And all the cattle summing to 40 million, all the goats summing to 31 million, and all the sheep summing to 10 million, not without forgetting the chicken summing to 120 million, have been vaccinated. It's a very big achievement. We can clap hands for that. And this vaccination campaign is ongoing. As we are talking now, if you have a cow at your home, when you go back, you will find it is receiving a second dose of vaccination. And the purpose is to make sure that diseases are prevented by either biosecurity measures in our farms, by either vaccinations, so that we minimize unnecessary treatment, especially by use of antimicrobials, which are used up to 2 million kilograms in livestock each year. And for this year, last year and this year, we are noticing some decline in the use of antimicrobials, which is connected with the ongoing campaign of biosecurity practices in our farms, but also vaccination. But equally the same, nationwide, apart from reducing the unnecessary uses of antimicrobials in treating sick animals, but tremendously the diseases which are transmissible between human being and animals and vice versa have also tremendously gone down. We talk of Mycobacterium bovis as a cause of tuberculosis in human being and the cattle. We talk of brucellosis as a cause of frequent fever and abortions. We talk of so many other troubles, including the Rift Valley fever and others, which most of them are preventable by vaccination. So the campaign which are going on, not only are going to reduce the troubles in livestock, but also we are expecting some escalation of tremendous reduction of some sufferings and patients who otherwise are attending our hospitals in Tanzania. But food safety has likewise been enhanced by vigorous inspection, of which we are saying that all the slaughter animals should be inspected for their health before they are slaughtered, and all the meat, the milk, the eggs, and the fish before are authorized for human consumption. They should be inspected and certified to be free from biological hazards, for this case, the disease-causing agents, which could be transferred to human being through the food, but also they are free from the residues. And this is another milestone of which we are looking forward to reduction of antimicrobial resistance, which is otherwise a problem nationally, regionally, and globally. But collectively, this high impact efforts have significantly reduced the risk of foodborne diseases, reinforced health systems, and reduced indiscriminate uses of antimicrobials in livestock, and has tremendously advanced the EMARA commitment across this country called Tanzania. Ladies and gentlemen, Tanzania has established a robust system to ensure the availability and accessibility of safe, high quality, and effective antimicrobials for the community, for the Tanzanian. And this has been made possible through having a very smart and centralized system, the medical store department, which oversees the procurement, storage, distribution of medicines, including antimicrobials. But additionally, the Tanzania Medicines and Medical Device Authority, TMDA, serves as a national regulatory body, as the only national regulatory body which is responsible for safeguarding safety, quality, and efficacy of medicines, medical devices, and veterinary products. This is a very big achievement, that all the issues are controlled centrally to minimize mingling and cheating, and TMDA has been doing a very wonderful job. We can clap hands for TMDA if we don't mind. But furthermore, Tanzania enacted the Universal Health Act to ensure equitable access to high-quality health care services for all. This initiative is complemented by having availability of the standard treatment guidelines and the national essential medicine list for both human and veterinary practices, of which it incorporates the AWARE, meaning access, watch, and reserve, categorization of antimicrobials, so as to promote their judicious use. You go to veterinary practice in 2016. And now we are at the stage of well